Hello, my name is Dr. Lanikque Howard, and I serve as the Director of the Office of Community Services within the Administration for Children and Families in the U.S. Department of Health and Human Services. It is my distinct pleasure to introduce myself as well as our administration to this remarkable medical legal partnership network. The theme of the 2023 Medical Legal Partnership Conference, Equity, Evaluation, and Evolution, resonates deeply with me. Advancing equity is a Biden-Harris administration priority that flows throughout the administration for children and families, and is certainly one of the top 4 priorities for the Office of Community Services. In fact, on February 16th, the Biden-Harris administration issued a second executive order to further our commitment to advance racial equity for underserved communities throughout the federal government, and we are proud to be able to advance this work within the Office of Community Services. The Office of Community Services, also known as OCS, is responsible for administering approximately $12 billion to support 7 anti-poverty programs, 4 Block grant programs, and 3 discretionary programs, all aimed at addressing the causes and consequences of poverty, increasing the self-sufficiency of individuals and families, and revitalizing communities. OCS is a part of the Administration for Children and Families, which is situated within the U.S. Department of Health and Human Services. Under the leadership of Assistant Secretary January Contreras, ACF promotes the economic and social well-being of children, youth, individuals, and communities who are resilient, safe, healthy, and economically secure. OCS programs and services range from energy and water assistance to community economic development efforts, to housing, food, and diaper assistance, to workforce development efforts, to rural water and wastewater supports. OCS partners with states, tribes, territories, nonprofits, community action agencies, and other social service organizations to carry out our mission and vision. Today, more than ever, we see the vital role OCS-funded programs play in helping to address persistent poverty and pervasive disparities and inequities. And to achieve our vision, thriving communities where children are able to live choice-filled lives and where everyone has the opportunity and support needed to achieve their full potential. We have to take every viable and tangible action we can to achieve our goals. We're working to achieve our goals through OCS's 4 priorities. 1, ensuring the programs we administer are of the highest quality possible and are reaching those who are most in need. 2, lifting up voices from the field and using lessons learned to be thoughtful, inclusive, and innovative in our approach. 3, identifying opportunities to break down silos and implement cross-cutting initiatives within OCS and ACF and across the federal government. And 4, amplifying OCS's many connections to the Biden-Harris administration's top 4 priorities for better supporting families and communities. We approach our work across all 7 of our programs with these priorities in mind. We are excited to be administering the first ever federally funded demonstration program for medical legal partnerships. As someone who has funded MLPs in the past and who has witnessed firsthand the life-altering impact of MLPs, I truly believe this funding is a testament to the powerful impact of medical legal partnerships on vulnerable individuals, families, and communities. I look forward to adding resources for MLPs to the suite of supports and services administered by OCS and contributing to the body of knowledge and evidence-based practices that inform policy and programmatic decisions about MLPs. And I would be remiss if I did not acknowledge the early work of our HHS colleagues and partners and the Health Resources and Services Administration for paving the way for medical legal partnerships by recognizing civil legal aid as enabling services, ultimately allowing health centers to use funding to support the work of MLPs. I'd also like to acknowledge the tireless efforts of all of you in the room, as well as your colleagues who are implementing MLPs across the country. The OCS team is looking forward to partnering with this multidisciplinary network to accelerate access to concrete supports, address systemic inequities, ensure proper legal representation and access to the justice system, and mitigating barriers that preclude families from living healthy lives. Together, we can address the dynamic and multifaceted nature of poverty and increase the health and well-being of vulnerable children and families. Please know that our team is working diligently on the notice of funding opportunity, which will provide more details about the desired activities and outcomes for this pilot program. We anticipate that the funding forecast will be published on grants.gov in the coming weeks. Once the forecast and NOFA are published, we'll be sure to both share it broadly and with the MLP network. Thank you for inviting me to speak with you today. I look forward to building our relationship and working together to improve the health and well-being of individuals, families, and communities across the country. Thank you, and I hope you have a good rest of your conference.